Hello, everyone. Thank you for having me. I'm Kennedy Lamwenya, the founder and CEO at SunPoynt Health. In this presentation, I'll be showcasing how SunPoynt Health is accelerating access to healthcare services within the Kenyan slums utilizing waste. Our mission is focused on accelerating access to basic healthcare services for women and children in slums. Looking at these statistics is quite shocking, whereby 60% of urban residents live in slums. 85% of these communities within slums have no access to healthcare insurance due to high cost of premiums that they're supposed to pay every month. Additionally, they are reported a 40% mortality rate among slum children under 5. This one directly tells us that most children below 5 in slums are not able to celebrate their 6th birthday. Finally, it's quite shocking that slum areas exhibit 35% mortality rates among expectant women who are not able to access hospital delivery services, where most of them are left to deliver at home with very minimal quality service and care. Despite all these challenges experienced in slum communities, SunPoynt Health believes its waste to health model is able to provide a sustainable long-term solution towards increasing access to healthcare services. SunPoynt Health is a micro-insurance provider converting waste in slums into an insurance fund to be able to provide insurance services for our members to access healthcare. Using our model, we are able to convert waste in slums into a health fund to enable our members access healthcare services from our partner healthcare centers that we work with within slum areas. In a nutshell, we collect and convert waste in slums into a health fund for uninsured poor slum dwellers while improving sanitation and hygiene. This is how our model works. We register members who are supposed to collect waste. The waste they collect is delivered to us, where we sell the waste to our partner recycling companies. The money we generate is converted into a health fund that provides healthcare payment for the healthcare services that our members receive. And then additionally, we are able now to connect with our partner healthcare centers who treat our members on case by case every month for payment of all the claims as per how many members visited the facility. Much into details, this is how our model works. The members we register are supposed to collect 40 kg worth of garbage every month. This waste we collect it, clean it, and we cut it into small pieces, and then we sell it to our partner healthcare, our partner recycling companies. The money we generate, which is equivalent to $8 per 40 kg of worth of garbage per member, we share this money into a given ratio, whereby we allocate 4% of this fund towards covering the monthly healthcare premium for our member to access healthcare services within our partner healthcare centers that we work with. Our members are guaranteed 2 monthly clinic visits covered by the $4 that we be able to allocate to them. And then we spend the $2 per member to cover our operation cost, and then we make a net profit per member of $2 in the entire $8 that we collect from 45 kg sale of waste that we generate every month. Since launching our service in 2016, we have one active center in Mathare slum. Mathare is one of the biggest slums in Nairobi with over 600,000 communities. Up to date, we have 1,220 active women members who deliver waste every month and actively receiving healthcare services. We have been able to connect 1,500 expectant women to prenatal checkups since the time we launched 1 year, 2006. Additionally, 3,000 children under age 5 have been able to receive various healthcare services in terms of vaccination and treatment and drugs as per the case that arose. Then we've been able to reduce plastic litter by 70%, and we have collected 55 tons of plastic waste since we launched. And more impressively, we have been able to generate $10,000 in monthly revenues. We have various actors being able to provide healthcare access in slums, but we believe SunPoynt Health has a sustainable long-term model whereby we are able to focus in remain in the community and utilizing utilizing free resources like waste to provide healthcare services, contrary to our competitors who basically are dependent on one donor funds and then only target salaried people can be able to afford the premiums, and also be able to provide basically the bureaucracy that are coming. So we believe waste is available in slums and the communities are willing to collect. So we are involving the community to be able to solve their own problem using the freely locally available resources. Looking at our income statement, it's worth noting that we've been profitable right from year one when we launched, and we are projecting to remain profitable as we progress into our next 5-year plan, and we'll be reaching a profitability base of above $500,000 in net profits in our fifth year, and we look forward to break even in the early 2018. Looking up at our projected financials, SunPoynt Health will be able to support its strategic initiatives moving forward, utilizing the baseline profits that we've been generating right from year one up to our projected 5-year plan moving forward. We focus at not only providing healthcare insurance, but also being able to connect our members to healthcare information. We will also be able to looking at expanding into other 6 new regions in Nairobi and Mombasa to be able to target slum communities, and also be able to grow our membership from 1,500 to 800 in the next 4 years, we believe, because of the demand of our service. At SunPoynt, looking at our strategic goals, we've been able to structure and come up with key goals that we want to enable our service to really be impactful and also increase its service base. So we have identified 4 key areas that we want to expand in. Basically, we are looking at being able to set up our mini recycling plant, plastic recycling plant, so that we don't depend entirely on our partner recycling companies, to be able to enable us to recycle our plastic that we collect into fencing posts and we sell it at a premium, which will also going to increase our revenues. We are also looking at setting up new centers in Mathare and Gorgocho slums to increase our membership, and also roll out a mobile platform to enable our members also access information apart from just healthcare, and also set up an impact division to enable us measure impact metrics. In that regard, to be able to reach those milestones, we are seeking an investment of $150,000 in grant and $100,000 in a 12-month convertible note to enable us realize all those goals, whereby a big chunk will go into setting up our own cycle plant, which is very key on our radar because to enable us to build our revenues and also be able to scale our operations. So looking forward, we'll be looking at to be able to build a holistic service to enable us to remain sustainable moving forward. Behind this great work, behind this revolutionary idea, is a passionate team of 20 Represented here is the senior team that is driving the vision and driving the operations of our objective and our company. So I'm the CEO and founder. I have 9 years experience in business operations and 6 years experience in operation in social entrepreneurship. We have anything good in terms of sales. We have Judith Sabo and Simon Kavahere, both passionate and building and work with a team of 10 volunteers based in the Kenyan within the slums that we are working from. This is a happy member who has been with our service since we launched in 2016, and she is sharing a passionate view about how we've been able to support her and how she has benefited from our service. She is really sharing a touching story that representing all our members who have been on our service since when we launched up to date. So we are inspired by her testimony, and we look forward to increasing our impact and connecting more women in other new slums as we move forward. Looking at this lady, we see a sorrowful face whereby this lady is a non-member who is based in a nearby slum. She heard about our service, but she can't be able to access. We are looking forward to your support to enable us connect this lady to our service to be able to also give a smile and also be able to give a positive testimonial. Join us in this journey of change and let us make slum communities little heaven for slum communities and build and increase access to healthcare and improve livelihoods for children, women, and the entire generation. Thank you.